Social media has created this vision of perfection. Many times we'll have a 21 or 22-year-old female that is coming in and they're looking to go from the 98th or 99th percentile of looks to absolute perfection.
Striving for a flawless life with perfect grades, perfect relationships, and perfect looks may seem appealing, especially on social media. However, research indicates a link between excessive social media use and elevated levels of depression, anxiety, and body dissatisfaction. This leads many individuals to question their appearance and contemplate enhancements.
You always criticize yourself, when you look at yourself in the mirror. So I feel like a lot of patients, they do come insecure and they're like, I just want to look prettier. I'm like, you're pretty.
In fact, medical experts say that medical grade skincare is a great alternative to enhancements like filler and Botox. However, the boundary between personal choices and the latest trends is increasingly blurring in today's digital age. If you are considering getting the injections, here's what you need to know.
There's 5 major brands that are on the market right now. Today I think it's important to highlight 3. These 3 brands that I'm going to talk about are going to be the most prevalent in the med spa or aesthetic space, and those are going to be Botox, Xeomin, and Dysport. Xeomin is going to be the newer form of botulinum toxin. It's thought to be a smart tox or a clean tox. It's going to have a little bit more of a gentle hold after being administered. People like this. I love to use this as a first-time treatment for people. And then when we talk about Dysport, it's going to be a different molecule. The dosing for this is going to be a little bit different. It's thought to kick in a little bit faster, somewhere between 2 and 5 days versus 7 to 14 days with Botox and Xeomin.
But apparently, it turns out a regular dose of neurotoxins can help with more than just facial aesthetics. It can also provide off-label relief for some unrelated health issues.
It helps with sweating, so palms. People also have armpit sweat. You can also do Botox in those areas as well too, so it helps. It decreases the sweat glands.
Probably the most popular is TMJ pain or clinching. Sometimes people will be referred to us from local dentists in the area, so we'll administer some neurotoxin into the masseter muscle. They'll stop clinching. This also helps for facial slimming. It's also going to help for migraines a lot. In the same fashion that people are not going to clinch, it's also going to help with the muscles that are surrounding the scalp and relieving some of that tension.
But the primary use for these neurotoxins remains what it was created for: wrinkles and fine lines. And as the reach of social media platforms such as Facebook, Instagram, TikTok continues to expand, the number of people exposed to information regarding these procedures continues to increase, affecting both demand and the patients looking for cosmetic treatment. But don't fall for the deception.
Don't chase the gimmicks. When you're seeing these things on Instagram that are like Botox creams or Botox masks, those are things that could give you a really nice result for 24 to 48 hours, but they're not actually going to chemically reduce the formation of fine lines and wrinkles.
And if you're looking for a good price, you know the saying, if it sounds too good to be true, it probably is.
What patients should be wary of is extremely low prices or wild deals that are variants from what they're seeing from other providers in the area, and just making sure that you're going to a board-certified provider.
The influence of social media on people's decisions to get enhancements can't be ignored. It has significantly contributed to the popularity and demand for these procedures. But by seeking guidance from qualified providers, maintaining realistic expectations, and using social media as a research tool rather than a vision board, you can potentially avoid overdoing it or even getting some faulty services.